Dear students, in previous lesson 2 of week 4, we discussed about syphilis, the transmission, symptom, and the prevention. I wanted to recall about prevention of syphilis as if a woman is pregnant, it can be treated by using antibiotics to be cured and to protect their babies, while a baby born with syphilis needs a daily penicillin treatment for 10 days. No one can develop natural immunity to syphilis, so past infection offer no protection at all. Since both syphilis and gonorrhea are spread in the same way, ways of prevention are very similar. However, on using condom, remember that the condom can prevent transmission if the initial contact source is on the penis or in the vaginal area, because the transmission can still occur. If the sources are outside the area covered by the condom, for example in the mouth, it is difficult to treat. This is what I have discussed yesterday, but today in this lesson of week 4 of lesson 3, we are going to discuss about the remaining sexual transmitted infection known as chancroid and some of the last topic of chapter 4 about HIV/AIDS. The objective of this lesson, after completing this lesson, the students will be able to explain about sexual transmitted infection or venereal disease, also called chancroid, list proper methods of using medicine, describe about the transmission and symptoms of HIV/AIDS. This is a certain type of sexual transmitted infection, which is called chancroid. This is caused by a bacterium called Haemophilus dicari. It's more commonly seen in men than women. The infection often produces painful sores, usually in the genital area, head of penis, labia, anus, and cervix for women. Although the disease is not too serious by itself and it can be cured easily using antibiotics, it is a very serious problem because the ulcers caused by the infection increase the likelihood of becoming the infected with HIV/AIDS. This is one of the transmission way of this type of disease known as chancroid is having sex with infected person. The symptoms. The first symptom of chancroid is sore ulceration of the genital, particularly on the penis head. They are soft and filled with pus. Pus is a fluid with a reddened edge. The ulcers bleed easily on contact and can burst with pus draining out. They are painful, especially for men. The second stage of the infection is that the lymph gland in the groin also become infected, often in only one side of the body, but sometimes both. The glands swell up to form bulbs filled with pus. This can also burst, releasing thickening pus and forming large painful ulcer. Eventually, the body overcomes the infection, but permanent loss of tissue from the penis or groin may take place before healing takes place. So, the main symptoms are sore ulceration of genitals like penis, soft and filled with pus with a reddened edge, painful for men, ulcers bleed easily on contact, permanent loss of tissue. Those are symptoms of chancroid. Its control and prevention can be treated easily with the dose of antibiotics. If the disease has spread and the lymph glands are infected, antibiotics will still cure the disease, but the glands may need to be drained of their pus to help the healing process or repairing process. Prevention of the spread of chancroid is very important, both to stop the disease itself and, more important, to reduce the spread of HIV/AIDS. Preventative measures of syphilis and gonorrhea are also common for chancroid. In addition, in order to lower the rate or even get rid of the disease, good genital hygiene and men's circumcision reduces the risk of getting chancroid. So, we can control and prevent. In general, chancroid can be cured by using antibiotics, by having faithfulness, by using condom, good genital hygiene, circumcised men make clean penis, do not have sexual relationship with anyone until treated. The following steps are very important to overcome transmission. Be faithful to your sexual partner. Use a male or female condom when you have sex. Good genital hygiene. If you wash your genitals carefully after you have sex, this greatly reduces the risk of catching chancroid. If males are circumcised, this reduces the risk of getting chancroid, and it is easier to keep the penis clean. If you think you might be infected, do not have sexual relations with anyone. Visit a clinic, doctor or nurse as soon as you can to get antibiotic treatment, and tell any sexual partners you may have so they can be treated too. This is how we can treat chancroid. Dear students, the next part is about medicines. How we can use medicines. Both modern and traditional medicine can be useful, very useful in revealing symptoms and curing a disease. But those medicines have their own unique features. So, how we can use medicines? Using at regular intervals through the day. Do not take more than you are prescribed. Do not take less than you are given, as the drug will not work properly if the dose is too low. Make sure you finish taking all the medicine. If you do not follow the instruction when you are given antibiotics, antibiotic resistant bacteria may evolve, which can be very serious indeed. Read the instructions that come on the packet with your medicine. Keep all medicines well out of the way of children. Make sure you store medicines at the right temperature. You must be very careful with self-prescribing due to many risks associated with the practice. When you self-medicate, if you are absolutely sure that you know what you are doing. This is all about 4.2 part, and in this lesson we are going to again discuss about 4.3 of HIV AIDS. As now you are familiar with this topic because you have learned it in lower grade. Acquired immunodeficiency syndrome AIDS is a medical term for a combination of illness that results when the immune system is weakened or destroyed. This is mainly a disease which is caused by HIV virus, which is known as retrovirus. The advanced form of infection is caused by immunodeficiency virus, human virus, which attacks the immune system, making the sufferer susceptible to the other disease. The virus that causes AIDS by inserting its RNA into the host cell, where it is reverse transcribed to DNA to perform replication, known as reverse transcriptase of enzyme retrovirus function. HIV AIDS primarily can affect sub-Saharan countries like Africa, especially Ethiopia, due to lack of efficient health center, lack of awareness for preventative method, and absence of knowledge for technology use. Let's look at about the history of AIDS. AIDS is epidemic by affecting more people than ever before. About 33 million people were living with AIDS in the world. From that, high population is affected were female, and next the remaining ones are male, which mean about 16 million are boys and 17 million are women from the world HIVs which are infected. This shows females are more affection than that of male due to multiple sex patterns, and also 2.2 million people from Ethiopia from that data. Furthermore, again 2 million children were living with AIDS in the world. From that, 11.6 million were orphans in Africa, and from Ethiopia 650,000 children were orphans. This is the data that shows this is how HIV is prevalently distributed in the map of Ethiopia. So if you look at the map, high proportions of HIV distribution is in the area of regions of called Amara region, which are highly populated. and so on. So look at the map or the diagram, which is highly populated, lessly populated with HIV virus, and so on. This is also taken from your textbook. The way of transmission: HIV/AIDS is transmitted mainly with spread from one person to another by having sexual activities, which is obvious, vaginal, oral, and anal. But it can pass from mother to baby in the womb during birth or when she breastfeeds. It can also be spread through the infected bleed on sharp materials or through infected blood transfusion, and also sex with infected drug users, including multiple sex patterns. So the main transmission ways were what I have told you is by using by having multiple sex patterns, sharing utensils or needles and syringes, by sexual activities during pregnancy from mother to child, sex with infected drug users, and during blood transfusion. Those are the main transmission way. The symptoms of HIV/AIDS. These symptoms of HIV/AIDS is from 2 up to 12 years. Mainly HIV/AIDS is asymptomatic, having a strong immune system. But the main target of HIV/AIDS is weakening the immune system. It weakens the immune system. When you count the T cell or white blood cells of a normal person, which is 200, if it is not 200, the normal T cell or white blood cells of a given person is 1200. So if below that, the person may be affected with HIV/AIDS. But highly those people which are mainly affected with HIV/AIDS have around 200 T cell, even if when they count by having CD4. This is also one of a symptom. So the symptoms of HIV vary depending on the stage of infection. Though people living with HIV tend to be most infectious in the first few months, many are unaware of their status until later stages. The first few weeks after initial infection, individuals may experience no symptoms or an influenza-like illness, including fever, headache, a rash, or sore throat. Those are symptoms of HIV. This is all about today's lesson about HIV history, transmission, and the symptom, plus sexual transmitted infection, so-called chancroid. Thank you for your attentive listening. Goodbye.